We are continuing with psychiatric section and subject today is schizophrenia. Schizo means splitting and phrenia thought, so splitting of the thought. I'm sure that you heard and even seen patient with schizophrenia in your life because statistics tells us that 1% of the population have this disorder and recognizes them is easily because they have some disorganized speech and behavior and of course inadequacy. Let's start with definition. It is a serious mental disorder that impairs judgment, behavior and ability to interpret surrounding reality. For establishing a diagnosis, symptoms must be present for at least period of 6 months, so more than 6 months. If symptoms are present less, it can be classified as a schizophreniform, schizoaffective, or disorder or psychosis. For sure, it should be at least 6 months of symptoms and 1 month of active phase symptoms. As I told you, statistics tells us that 1% of population, so for every 100 people, 1 is affected. 2% also are affected with bipolar disorder. 60% of population have mood disorder, and so ahead. By this results that almost population have some disorders or deviations from normal. It's funny. Causes of schizophrenia. So men of age 15 to 25, high level of dopamine or serotonin level, so neurotransmitters have the direct relationship with this disorder, especially dopamine. Born in the winter or early springtime, low socioeconomic state groups, family history, especially if one of the parents have schizophrenia, and twins. Symptoms. The most important part of the disorder represents symptoms, and schizophrenia may result in some combination, not only one symptoms, combination of hallucinations, delusions, and extremely disordered thinking or disorganized speech and behavior. Impairs all these symptoms impair daily activity and functioning and can be disabling, scattered, or fragmented pattern of thinking. So hallucinations, delusions, disorganized speech and behavior, and catatonic behavior represent the positive symptoms. Positive symptoms of the disorder. And negative symptoms, which we will talk later, there are also 3 of them. So hallucinations can be any kind of sensation that's not actually there, including visual, but also can include auditory sensations like hearing voices or commands. Delusions, second one, are false beliefs that the patient might feel very strongly about, so much so that they will not change their mind even if you give them evidence against it. So there are all sorts of different delusions, like delusions of control, where somebody thinks that that outside for forces or person or anything is controlling their actions. Also could be delusions of reference, where someone might think that insignificantly remarks are directed at them, like Newcaster is speaking directly to them through the TV or radio or any of the devices. A third type is disorganized speech or behavior. An example being something like word of salad, which seems like just random jumbling of words or phrases like dog, cat, pencil, head, coffee, school, and so on. Disorganized behavior, on the other hand, could be like if they exhibit behavior or silly behavior that's out of context and doesn't seem to have much of a purpose. Like wearing multiple layers of jacket, a lot of jackets that in the hot summer day, which is not corresponding. Also, sometimes the behavior is described as catatonic, which has to do with their movement, like postures and responsiveness. So, like they might be super resistant to moving or be in an unresponsive stupor. How about negative symptoms? So, are like when there is reduction or removing of normal processes. And this is like a decrease in emotions they can express, or loss of interest in things that once found interesting, mostly. One type of negative symptoms is called flat affect, where they don't respond with any emotion or reaction that will seem appropriate, like if they saw something very unexpected. Another type is alogia, or poverty of speech, which is lack of content in speech. So, like if somebody asked them, "Do you have any children?" or anything else, they might respond with only yes or no instead of giving a detailed response. A third type of negative symptom is avolition, which is the decrease in movement to complete certain not movement but motivation to complete certain goals. So someone might stay at home for long period of time without trying to reach out friends or relatives, or trying to work, going to work. And finally, cognitive symptoms, which include things like not being able to remember things, learning new things, or understanding others easily. These symptoms are more subtle, and more difficult to notice, and might be only detected if they have really specific tests performed. Differential diagnosis, you should differentiate firstly with substance abuse if patient do not take any of the stimulants, hallucinogens, or substance of abuse like alcohol or glue. Barbiturate withdrawal, in this phase they can be excited epilepsy, especially temporal lobe epilepsy, other psychotic disorders like schizoaffective, schizophrenia, brief reactive psychosis, and delusional disorders, which I told you, and they have less period, around months, from 1 month to 6 months, and less than 1 month. Malingering and factitious disorder to achieve some goals, especially money. Medical conditions like steroids, tumor, especially central nervous system tumor, personality disorder. And you must look at duration. Once again, look at duration from 1 month to 6. And if more than 6 months, it is schizophrenia. If between them another, and less also. Treatment, very important part of the disorder. First of all, hospitalize patient, because it cannot be treated at home. Patient is inadequate and will not take pills correctly or at all. So hospitalized patient, give antipsychotics and psychotherapy just after antipsychotics. What are the antipsychotics to give? So there are type like first generation and second generation, like haloperidol intravenously, especially for resistant type of schizophrenia we are giving clozapine. What you can see here, a lot of side effects like weight gain, glucose abnormalities, hyperlipidemia, akathisia, Parkinsonism, dystonia, tardive dyskinesia, prolactin elevation, sedation, anticholinergic, orthostatic hypotension, and QT prolongation. All of these effects are from dopamine antagonism, and doses can be found also on some of the sites. Complications. Do this disorder can have some complication? Of course. Suicide thoughts and attempt, of course. Anxiety disorder and obsessive compulsive disorder, depression, abuse of any of the substance, inability to work or attend school or any of the occupancy, financial problems and homelessness, social isolation, medical problems, being victimized, and aggressive behavior. So if you are feeling that have some symptoms, or anyone that is living close to you, you can trying to help by going to the doctor and have a consultation. Have a great time and study hard.